Treatment beds for those struggling with opioid addiction, which killed about 2,000 people last year in Massachusetts, have been hard to come by. The Stonybrook, Stabilization, and Treatment Centers in Springfield and Ludlow, run by the Hampden County Sheriff's Office, will have a total of 86 beds for those who have been civilly committed by a judge for substance abuse, including opioids. These new facilities have been funded through cost-saving measures by the Sheriff's Department and will make use of the space in Ludlow and at the Western Mass Recovery and Wellness Center on Mill Street in Springfield. Carolee McGrath sat down with Sheriff Cocchi and has more.
The 86 new Section 35 civil commitment beds are going to be divided up between Mill Street in Springfield and here at the Stonybrook facility, which will be the acute detox portion of it. So you come directly from the court to Stonybrook, you detox with great attention and medical care. And once you're stabilized, we will then progress you in a step-down mode to Mill Street in Springfield, and that is where intense treatment, community services, wraparound service agencies will come in and start to plan your release and getting back into the community, hopefully with a very good recovery plan.
So explain what a Section 35 is. Is this somebody who has been locked up? Or is this somebody who's been committed, because their family has petitioned?
The Section 35 is a civil commitment, so you are not incarcerated. And some of the detractors of this initiative will say, why are you putting a person with addiction who hasn't committed a crime per se into a jail? I can assure you, when you see Mill Street, it is nothing but a treatment facility. It's the old Ring Nursing Home, it's a hospital, and it is very conducive to effective and positive change in addiction treatment. Here in Ludlow, people will say, well, that's a correctional institution. We have carved out an area. We have changed the entire inside. It's more like a living room. We've taken the locks off the doors, we've changed the color and the schematics of the unit, and we made it, again, a very calming and a very safe place for people to detox. Detox is dangerous. Alcohol detox is the most dangerous. And then when you get into substance abuse detox, people are sick, they need support, they need medical assistance, and to have them in an environment where we can continue to provide them that care so we can get them to the next step of recovery is very important. So as Sheriff of Hampden County, there was a call out there by the community. We need more beds. And when we say more, there was not one bed in Hampden County for Section 35 civil commitments.
Because they were all going to Plymouth, is that correct?
They're going to Plymouth, Massachusetts. The females would go either to Fall River or they would go to Jamaica Plains. Everybody was getting in the back of the van during the midst of their withdrawal, which is very dangerous, and going 2.5 hours from home to receive treatment. And the treatment may have been fantastic, and I'm sure it was, but the reentry approach was non-existent. And it's the reentry step down back to the community that is going to help somebody support somebody in their recovery process once they get back outside. So it's very important that we here in Hampden County are providing this resource for our community members. But more, it's not just Hampden County. We're going to service Worcester, Hampden, Hampshire, Franklin, and Berkshire counties. All those groups and all those counties will come to here, where we will then start to connect them, their commitments with their support service agencies in their individual counties. They don't need to be driving 3.5 to 2.5 hours away from home to get treatment. This is a very prevalent epidemic, and we need to start dealing with it right here at home.
Talk a little bit about the pivot from law enforcement over the last several years, not just the Sheriff's Department, but police departments all across the country, where you're looking at somebody who has an addiction problem as somebody with a disease as opposed to a criminal. Why is that so important to get and shift in order to get the appropriate help to folks?
Well, there's been a great shift in perception, and there needs to be a continued shift in stigma of what substance abuse use entails. 10, 15 years ago, lock them up, throw away the key mentality. Today, you hear police chiefs and you hear sheriffs talking about addiction treatment, talking about mental health stability, talking about what is it going to take to get somebody back to the community to be productive citizens and giving them the tools to do that. I believe the office of sheriff is the greatest office in the country. It is one of the most respected, but I believe it's the greatest, and I can tell you why. Because I get to talk out of both sides of my mouth. I get to talk out of this side and talk about people in recovery, talk about programs and treatment and education for the offenders when they come in. Anybody who comes to Hampden County their average sentence is going to be 9 months for a male, maybe 5 months for a female, even though they can stay 2.5 years. But if you're in Hampden County, you're going back in short time to the community members of this county. And it's my job. I am tasked with, and the staff here at the department are tasked with taking that individual who's angry, afflicted with substance abuse disorder, may have some mental health concerns, may have chronic illness. It's our job to take them, dust them off, pick them up, educate them, program with them, treat them, and get them ready to go back to the community as more productive people. But out of this side of my mouth, I also get to talk about, through the Office of Sheriff, is public safety. We need to provide safety for the people in the community who are law-abiding and trying to do the right thing every day. So it's a very unique office. It's one that I am so grateful to be in, and I'm very grateful to the citizens, and I make a promise to all the citizens of Hampden County and the people we serve. I will never govern this office as a re-election campaign. I will govern it in the way that people need for me to do that, to address the needs of our community in our county. And I believe if we do a good job at that, people will realize that the person sitting in the corner office at the sheriff's office is serving them every day, because we're public servants. It's not about the sheriff's department. This initiative of Section 35 is not solely the sheriff's department endeavor.
Now, talk a little bit about that, the coordination that's happening with your department.
Well, our department is providing the beds. We're going to oversee the program, but the services that are going to come in from all the community agencies, they're the driving force, and they're going to be a huge part of the success of the program in keeping people on target, on the right path, and involved in treatment and recovery over the years, hopefully in the decades to come, when they're not being served as a civil person with an addiction, or they're not incarcerated. So this is without question a community endeavor, and it can only be successful with the help of everybody. Nobody, no department will take a chunk out of this opioid epidemic by themselves. It's got to be a collaborative effort.
What kinds of things do you hear from either people that you have dealt with in the system, or from their families regarding this addiction crisis that we're in?
The number one thing I get from the community members as I'm speaking to Rotary clubs, as I'm out serving food to the homeless, wherever it is in the communities that I'm at, is that the opioid epidemic is ravaging every family. There is very few people, when you speak at an event, when I say, if you don't understand or know about opioids, your head's buried in the sand. There's very few people at that time, as I look around, that aren't shaking their head. It truly is an addiction and a disease that will infiltrate any race, creed, economic, social, any town boundary or line. There is no prejudice, and it is affecting not just our community and our county, it's affecting the Commonwealth, and it is ravaging the entire country. We have a battle on our hands, and as of right now, we do not have a handle on it. Are we slowing the train down? I believe we are, but that train has left the station, and it's going to take all of us to slow the train down, then pull it back and repark it back in the station. And that's what we come to work every day here at the Sheriff's Office, along with our community partners, every day working to try to do. Get that train back in the station.